there. How are you doing today? Great. Wonderful. My name is Dr. Mad. I'm going to do your cranial nerve exam. Okay. Before we begin the medical examination, I would like to gather some information about you. Is that okay? Okay. Let me go ahead and open your file. Good. May I please have your first and last name? Good. And your date of birth? Okay, perfect. Do you have any allergies? Okay. Are you allergic to any medications? Okay. Okay. And penicillin. Okay. Have you ever had an anaphylactic shock? No. That's perfect news. Do you have an EpiPen available? You don't. Okay. Well, we'll definitely order one for you. Good. And may I please have your full address as well? Okay. Illinois. Can I please have the zip code? Okay, perfect. And your phone number? Okay, perfect. In case of a medical emergency, can I please have someone to contact? Okay. And is that the same last name? Okay, great. And their phone number? Okay, perfect. I'm going to ask you a few questions about your medical history. Let's see here. I'm just gonna go ahead and open the cranial nerve exam related questions. Any headaches in the last 2 weeks? Good. Are you taking any medications at the moment? Oh, you are? Okay. Is it these ones? Okay. Okay. 10 milligrams. 1 tablet by mouth daily. And looks like you have 20 more left. I'm gonna go ahead and create a refill. Okay. Is 3 refills okay for that? Okay. I'm gonna just send it to the pharmacy right now. Great. Any high blood pressure in the family, or were you ever diagnosed with high blood pressure? Okay. Any stomach problems? Okay, you do. What about your eyes? Do you feel like you need a new prescription? Okay, I do see that you have glasses. When was the last time you changed the prescription for those glasses? Okay. And are you experiencing any kind of pain or muscle weakness? Okay. Good. Any coordination problems? Let's say you can't move your right arm or your left. Okay. None of that. Are you driving? Okay. Do you wear a seatbelt? Good. Okay. How many hours per night do you sleep? It's really hard, right, to sleep. Okay. No worries. After this exam, for sure, you're going to be able to sleep. Okay. And do you feel rested after 6 to 7 hours? Do you feel like you can start your day properly? Okay. Good. Okay. Any special diets that you're following? Okay. Any heart problems? Any kidney disease in the family? Any lung problems? Shortness of breath? Okay, perfect. Are you taking any vitamins, multivitamins? Okay, once a day. Good. Any surgeries, craniotomies, or something like that? No. Perfect. Okay. So we're going to begin with some vital signs. Okay. Let's go ahead and put on some gloves. They're right here. I'm going to use these special gloves today that I hope you will enjoy. What's really magical about them is that they're sterile. So I'm going to open them. Okay, and there's a special package inside. And also, another thing that I really love about these is that they're so easy to put on. Or at least that's what I thought yesterday when I tried them on for the first time. I can see that they're easier than normal to put on. Okay. Okay, without further ado, let's go ahead and just make sure that I have all the questions answered. Are you feeling any tingling sensation in your face, in your arms, in your feet, legs, back? Okay. And any vision problems? Okay. You feel like your peripheral vision is fading? I see, okay. Okay. I'm going to put this on your forehead. I'm going to take your temperature. Great. 98.2. And I'm going to take your heart rate here and your oxygenation. So this is going to go on your index finger. Can I please have that? Good. And just hold it like that. Sometimes it helps if you relax and take a deep breath in. Good. And exhale. Perfect. So your heart rate is a little bit elevated, 103. And your oxygenation is 98% on room air, so that's good. Maybe you're a little bit anxious. That could be, yeah. Okay, so I'm gonna go ahead and write it down. Heart rate was 102, and temperature was 98. Okay, let's go ahead and take your blood pressure. I'm going to put this on your arm. Is it okay if I put it on this arm for you? Okay, perfect. So just relax. This is going to give you a big squeeze. That's how it's going to feel on your arm. And I'm going to put it on the upper side of your arm. Perfect. Great. And we're going to put this down here. Okay. Now let me go ahead and put my stethoscope on. Yes, unfortunately, we're still doing it manually because sometimes patients may have very low blood pressure and it's really hard to detect that. So I prefer to do it manually. Okay. Okay. As like I suspected, your blood pressure is a tiny bit low. That's what happens when the heart rate is up. The blood pressure goes down. But what I like to do is to just make sure that this is how your blood pressure is, right? Okay. So your blood pressure is usually on the low side. Okay. Yep. Just like I suspected. Go ahead and write that down. It was 98/59. Okay. And I already have your respirations, which were about 16 respirations per minute. Perfect. And if it's okay with you, I'm gonna go ahead and just check your pulse manually right here on your wrist. Is that okay? Great. So just relax for me, please. Okay, I'm counting for a full 20 seconds at least. Okay, perfect. So your pulses are regular 2+. Great. Let's go ahead and listen to your heart and lungs. Okay, I'm going to put this on your chest. So just relax for me, please. Okay, good. Okay, perfect. And I'm going to move it a little bit to the side here in the middle of your chest. And on the lateral side of your chest. Okay. I'm going to go ahead and put it in medial. Okay. I'm not noticing any heart rhythm abnormalities. I'm going to go ahead and check with the bell. The bell is the smaller side of the stethoscope and it allows me to hear different kind of sounds. So just relax the same. Okay. Can you please take a deep breath in and hold it for 1, 2, 3. Perfect. And exhale. We're gonna do that one more time. And I'm going to put the bell a little bit lower. Take a deep breath in and hold it for 1, 2, 3. Perfect. Okay. I'm going to listen to your lungs now. So please take a deep breath in for me. And exhale. Perfect. Take a deep breath in for me. And exhale. Perfect. Okay. I'm going to listen to the signs. It's very important. Take a deep breath in for me. And exhale. Okay, good. Same thing. Take a deep breath in for me. Good. And exhale. Okay, perfect. Is it okay if I listen to the back? Okay. Take a deep breath in for me. Good. And exhale. Very good. Take another deep breath in. Good. And exhale. Perfect. Okay. Go ahead and do the same thing again. Take a deep breath in. And exhale. And the base of the lungs. Take a deep breath in. And exhale. Good. Okay. Well, very good sign. Everything sounds very normal. And this is what I want to see in all my patients, that's for sure. Okay, good. Okay. What I would like to do now is just to get a feel of how your head is constructed. Okay, I'm going to do some movements with your head at least, if that's okay. Okay, so just go ahead and relax for me. Okay, I'm going to just come very close to you and just try to feel your head. Are you having any pain when I do that? Okay, just going to palpate. Okay, the temporal bone. Good. The occipital bone. Good. The mastoid bone. Okay. Okay, head is symmetric around. I'm not feeling any lumps or bumps. It feels very smooth. No pain, no tenderness when I do this. Great. Okay. Is it okay if I check your scalp as well? Okay. Good. Perfect. Okay, so just relax your jaw for me, please. I'm going to very slowly feel your jaw. I'm not feeling any lumps. Also no tenderness, so that's very good. Okay. Can you please turn your head this way? Okay. Any pain when I did that? No. Okay, let's go ahead and turn that the other way. Let me know if you feel any kind of pain. No. Okay, good. Okay. Is it okay if I gently palpate your face? Okay. And I'm going to check your lymphatic system as well. So I'm going to check for any lumps in your neck. If you feel any kind of pain, let me know. Okay, I'm going to go ahead and just slowly palpate your clavicles as well. Good. Okay, perfect. Well, I'm not noticing any abnormalities. So what I'm going to do now is I'm going to check your muscle strength, your reflexes, and your coordination. Perfect. Do you feel like you can do this? You can. Okay, great. So let's go ahead and check your face first. I'm going to ask you to give me a big smile. Good. And now frown. Just do what I do. Don't worry about it. Puff your cheeks. Keep them puffed. So puff your cheeks and keep them puffed. Okay, good. And now, can you please push with the tongue inside the cheek? And do the same thing on the other side. Perfect. Okay. Can you please open your eyes as wide as you can? Good. Now close them, and I'm going to try to open them. Okay. Perfect. Can you please shrug your shoulders? Good. Okay, perfect. And can you please squeeze my fingers? Good. And on the other side. Good. So, very normal there. I'm going to ask you to put your arms like this in front of you. Okay. And can you please spread out your fingers just like this? And I'm going to try to close them. Don't let me do that. Good. And I'm going to do the same thing on the other side. Just keep your fingers like this. Okay. And I'm going to try to close them. Don't let me do that. Okay, perfect. And can you please keep your palm like this for me? Okay. And I'm going to put something in your palm. I'm going to need you to squeeze it. And then please tell me what you feel, okay? Okay. Go ahead, close your eyes. Good. And put your palm like this. I'm going to put something in your palm. Okay, go ahead, squeeze it. Okay. Can you guess what it is? Okay, perfect. Alright, I'm going to do the same thing on the other side. So go ahead, put your palm like that. And I'm going to put another object in your palm. Good, just keep your eyes closed. Perfect. And go ahead, can you please give it a big squeeze? Good. And open your hand. Okay. Can you please tell me what that is? Okay, great. Very good. Okay. Let's see. Okay, I'm going to check your face reflexes first, and then I'm going to move down the body and just slowly tap on bony prominences to make sure that your reflexes are properly working. Okay, so the first thing that I'm going to do is I'm going to tap on your face, and I need you to put your jaw a little bit lower. Good. And just leave it like that, relaxed, like this. Okay, perfect. So go ahead, relax your jaw. Good. Ready? Okay. Okay, good. And now I'm going to continue. You just stay relaxed. Good. Perfect. Great. Good. Perfect. Good. And one more time on your jaw. Wonderful. I'm going to go down your body now. Good. Good. Perfect. Okay, I'm gonna need your wrists now. Good. And I'm going to go ahead and move on the other side. Good. Perfect. Good. Perfect. I'm going to tap on your wrist as well. Very good. I'm gonna go ahead and move down your body, okay? Just relax for me. Can you please relax your knees? Good. Relax your knees. Good. And now I'm going to go ahead and move down. Okay. Good. Okay. Wonderful. Okay. I'm going to go ahead and check your strength. So, can you please put your arms like this for me? Good. Okay. Good. I'm going to try to close them. Okay, good. Don't let me do that. Good. And I'm going to try to open up your arms. Don't let me do that. Okay, perfect. And I'm going to try to push down on your knees, and at the same time you push up. Does that sound okay? Okay. Okay, so 1, 2, 3. Good. Okay, one more time. 1, 2, 3. Okay, good. Perfect. Okay. Next, I'm going to check your facial sensation. Since we're done with all of that. Okay, can I please have your palm? Perfect. So, this will be extremely sharp. Okay, and this will feel just like a pinpoint. Okay, and I'm gonna need you to tell me if it's sharp or pin. Sharp or pin. Sounds good? So go ahead, close your eyes. Okay, very good. Sharp, good. Pin, good. Sharp, good. Pin, very good. Sharp, good. Pin, okay. Did you feel that equally on both sides? Good, perfect. Okay, now I'm going to brush your face with a sensory brush. And this will help with healing if you do have any cranial nerve problems. And also it allows me to make sure that you do have full sensation on your face. Okay, so go ahead again, close your eyes and tell me where you feel this. Okay, good. Close your eyes again. Perfect. Did you feel that equally on both sides? Okay. Keep your eyes closed now. Good. Keep your eyes closed. Perfect. Good. Good. Great. And now I'm going to continue down your neck. Wonderful. Okay. And now we're back at the classic sharp or dull test. Okay, so definitely this will feel dull. And these will feel sharp, sharp, sharp. Okay, so go ahead, close your eyes. Tell me if it's sharp or dull. Okay, perfect. Sharp or dull. Okay, perfect. Sharp or dull. Perfect. Sharp or dull. Perfect. Sharp or dull. Good. Sharp or dull. Sharp or dull. Wonderful. Okay. I'm gonna go ahead and check your mouth. I know that I checked the reflexes and all of that, but can you please open your mouth? Let me just get a clean tongue depressor. And I'm just gonna need to open it. Good. So go ahead and please open your mouth as wide as you can. Give me a big ah. Great. So very normal gag reflex. Now can you please move your tongue up? Good. Now down. Good. Side. Good. The other side. Okay, very good. And I'm gonna go ahead and just check your uvula and the side of your cheeks. Good. And if it's okay with you, I'm going to check your teeth as well. Okay. Let's go on and just make sure that this is fully on. Good. Okay. And what I'm going to do is I'm going to slowly tap on your teeth. Let me know if you feel any kind of pain, tenderness, or even sensitivity. Okay? So go ahead, give me a big ah. Okay, good, good. Any pain? No, good. Okay. Perfect. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, good. And I'm gonna go ahead and tap on your upper teeth. Good. Any pain there? Good. Okay. Okay, wonderful. That's really great news. Okay. Okay. Dental exam is normal. No chapped teeth. No cavities. Normal muscle strength. Okay, perfect. So what I'm gonna do now is I'm gonna ask you to relax, and I'm going to check your eyes and just try to see how much sensitivity you have around your eyes. Okay, I know I just checked your face, but this is going to be with a different kind of tool and allow me to see your medical history better. Okay, so just relax for me, please. I'm going to just slowly tap. Okay, any pain? Good. Any pain? Any pain? Good. Any pain there? Any pain there? Any pain there? Any pain there? Good. Okay, perfect. Okay, I'm gonna go ahead and check your face. Okay, let's go ahead and try this. Can you please tell me what shape I'm drawing? Circle? Perfect. Can you please tell me what shape this is? Good. And I'm going to write a letter. Can you please tell me what letter this is? Good. Perfect. And one more letter. What letter is this? Perfect. Good. Okay. Okay, I'm gonna go ahead and check your sense of taste now. And I'm going to put a few drops on your tongue. I'm going to ask you to identify those tastes. Okay. So I'm going to ask you to open your mouth as wide as you can. I'm going to put just one drop. Tastes like coffee. Perfect. Okay, let's go ahead and try one more. Okay, I'm just going to put this on your tongue. Perfect. What does that taste like? Lemon juice. Very good. Okay. Go ahead, open your mouth. Okay. Good. What does that taste like? Pineapple. Excellent. What I'm gonna do now is I'm going to give you an extra one. Just okay. And I'm just going to put just one drop on your tongue, and you're going to love this one. It's my favorite. Okay, what does that taste like? Melon. Perfect. Yep, I love watermelon. Good. Okay, let's go ahead and check your nose now. I'm going to slowly tap on your nose. Good. Any pain? No? Okay, I'm going to move it side to side. Good. And I'm going to put one finger on your nostril. Can you please breathe in, breathe out? Good. And the same thing on the other side. Breathe in, breathe out. Okay, wonderful. Now I do have here quite a few smell samples, and I'm gonna ask you to close your eyes and please tell me what they smell like. I'm going to start with a basic one, okay? It's going to be extremely easy to identify this one. So go ahead, can you please take a smell? What does that smell like? Coffee beans, exactly. Okay, so we started good. Alright, now I have one that, it's not so pleasant, but it is incredibly strong if I know how to open it. No. Okay, and now I'm going to just continue with very basic smells as well. I just want to make sure that I shake them really well before I open the bottle, so it doesn't have a very strong smell, otherwise it's going to hurt your lining of your nose. Okay, good. So go ahead and cover one nostril for me, and can you please tell me what this smells like? Okay, perfect. It is lavender indeed. Okay, and I'm going to give you another try. So go ahead and cover your other nostril now. What does that smell like? Good. Perfect. It does smell like vanilla. Okay. And now I think you can leave your nose nose alone. You don't have to cover one nostril or the other. So you can smell with both the nares. Just tell me what this smells like. It smells so good. It smells like lemon. Very good. Okay. It smells amazing. Go ahead and tell me what this smells like. Good. It smells like rose petals. Yes. Great. Okay. I do have one more. Same thing. I'm gonna have to make sure that I shake it really well. This one smells really good as well. So can you please tell me what this smells like? Smells like lavender. Yes, it does. That's perfect. Okay, I'm gonna go ahead and take a look inside your nose next. And I'm looking for the otoscope, and I found it right here. Perfect. So I want to make sure that your nasal mucosa looks very pink and healthy. So go ahead and look up for me. Okay, good. Wonderful. And I'm going to look on the other side as well. Good. I'm gonna go ahead and check your hearing next, and your ears, of course. So I'm going to slowly palpate your ears and behind. Let me know if you feel any kind of pain. I'm going to tap on your mastoid bone. Any pain when I did that? Good. And I'm just going to slowly inspect. Good. Good. Okay, perfect. I'm gonna go ahead and check your hearing with a vibration sound, and I'm going to strike a tuning fork, and I'm going to put it right here behind your mastoid bone. And can you please tell me when you don't hear, no, when you don't feel the vibration anymore, okay? Now? Okay. And which sound here is louder? This one or this one? This one. Very good. I'm going to do the same thing on the other side. Okay, tell me when the vibration sound stops. Now. Good. And which one here is louder? This one or this one? Definitely this one. Okay. Good. I'm going to do that one more time. Okay, can you please tell me when you don't hear the sound anymore? Now? Perfect. Okay, can you please tell me when you don't hear the sound anymore? Okay, I can still hear it. What about now? Stopped. Perfect. Okay. And now I'm going to check your hearing with a different type of tuning fork. It's going to be a more of high-pitched sound. Can you please tell me when you don't hear it anymore? No. Perfect. Okay, can you please tell me when you don't hear it anymore? Now. Okay, perfect. Okay, I'm going to whisper some words in your ears, and can you please repeat them back to me? Mad P ASMR. Perfect. I want my tingles back from you. Wonderful. Do you like coconut milk? Great. After rain, there comes a rainbow. Wonderful. And now I'm going to just say some shorter words. Same thing. Please repeat them back to me. 100. Good. 99. Perfect. I'm going to come a little bit closer and I'm going to whisper so you're not going to be able to tell what I'm saying, but hopefully you are, so let me know. 63. Okay. 21. Okay, perfect. Tingles. Good. Rabbit. Great. Cloud. Good. Indigo. Indigo. Perfect. Purple. Purple. ASMR. ASMR. Okay, wonderful. So nothing to be worried about there. And if it's okay with you, I'm just gonna go ahead and very quickly check the inside of your ears, each ear, okay? And I'm going to look for the tympanic membrane, make sure that it looks a normal color, okay? So go ahead and look that way for me, please. Good. Okay, looks very good. I'm able to visualize the tympanic membrane. Okay. Very normal color, everything looks healthy. And now if it's okay with you, I'm gonna ask you to look that way for me. Perfect. And this looks good as well. Wonderful. Love it. Okay. Let's go ahead and check your eyes. Okay, I love this part. The eye exam is one of my favorites. You love it too? Great. So that means we're both going to enjoy this very much. Okay, go ahead and look at my nose. Keep on looking at my nose. Good. Keep on looking at my nose. Okay, now I'm gonna need you to look right here. You see this very white spot? This way. Good. White spot. Just keep on looking there. Good. Keep on looking there. Okay. Now can you please look right here at my chin? Good. Look right here at my chin. Okay, perfect. Can you please tell me when you don't see the light in your field of vision anymore? No, good. No, good. No, good. No, good. No, good. No, good. Okay, can you please look at the light right here? Perfect. And just follow the light with your eyes only. Don't look, don't turn your head, only your eyes. Perfect. Good. Good. Okay. Wonderful. Okay, I'm going to ask you to look at my finger right here. I'm going to approach my finger very close to your nose, so keep on looking at my finger, okay? Okay, good. Perfect. Let's do that one more time. Look at my finger. Good. Keep on looking at my finger. Keep on looking at my finger. Keep on looking at my finger. Keep on looking, keep on looking, keep on looking, keep on looking. Okay, wonderful. Can you please look at my fingers right here now? Good. Now look at my fingers right here. Great. So now please tell me which fingers are moving, right or left. Good. Perfect. Good job. Okay. Now please tell me when you don't see my fingers in your field of vision. Good. Good. Perfect. Okay. Wonderful. Okay. So can you see the Snellen chart right here? Great. So what I'm going to ask you to do is to identify this color right here. Green. Good. And what about this color? Perfect. Can you please tell me what this letter is? Good. And what about this one? Good. What about this one? Perfect. Okay. What about here? Good. And can you please read this row starting with this letter right here? It's too far away? Okay. Well, you are wearing your glasses, right? You might need a new prescription then. Okay. Let's go ahead and check this one. Okay. Can you please read this letter? Not really. Okay. Can you please read this letter? Okay. What about this one? Good. 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 Okay. What number do you see here? Good. What number do you see here? Okay, perfect. And what number do you see here? You can't see it. Okay. No worries. Let's go ahead and try something else. Okay. I'm going to ask you to identify the shapes, okay? Can you please tell me what shape this is? Perfect. What shape is this? Great. What shape is this? Good. What about this one? Perfect. And what about this one? Okay, great. Okay, next we're going to try to read this card right here. So let's see. We're going to start with this line. Can you please tell me what number you see? 1. Good. And what what about here? Can you please read this word? This word. You can't read it. That's not good. Okay, let's go ahead and try this number right here. Can you please tell me what number this is? Okay, good. And can you see the numbers underneath? You can't. Okay. No problem. Let's go ahead and check your optic nerve and optic disc, okay? I'm going to come very close to you. And can you please bend your nose and hold your breath for me? Okay, go ahead. Bend your nose and hold your breath. Good. Okay. Looks like I'm not seeing any abnormalities. So go ahead and breathe. Good. Breathe normal. And I'm going to ask you to do the same thing one more time. Okay. Okay. I see. Well, I'm not seeing anything abnormal. Everything still looks good. Let's go ahead and put some eye drops in your eyes. Maybe that will help with the vision. Okay, so what I'm going to ask you to do is to look up. Okay, and let's do that one more time. Can you please look up, look up, look up, look up, look up, look up, look up. Okay. Can you please look at the light? Okay, just look at the light, look at the light. Look at the light. Okay, follow the light with your eyes only, don't move your head. Okay, let's go ahead and change the lens. Okay. Let's try that. Can you please look down? Okay, can you please look up? Okay. Okay, what I would like to do next is to check your corneal reflexes. So what I'm going to do is I'm going to try to touch your eye with a Q-tip. Very gentle. It's not going to hurt at all, okay? So can you please look right here for me? Okay, perfect. So just keep your eyes open as much as you can. That's why I'm saying keep on looking right here. Okay, see, that wasn't that bad. We're gonna do the same thing on the other side. So go ahead, keep on looking right here. Okay, so very normal corneal reflexes. Okay, I'm going to send you to an optometrist because I believe you do need a new prescription and we cannot do that today. Today we did the cranial nerve exam. All 12 cranial nerves are intact. I'm not noticing any abnormalities. And since you're not complaining of any pain or anything like that, I just say that we're going to send these 3 refill medication to your pharmacy to Do you have a preferred pharmacy? Yeah? Okay. Okay, great. So yeah, let's go ahead and send that in. Are you experiencing any symptoms right now after the cranial nerve exam? Okay. So you are incredibly sleepy, but you're not sleeping yet, right? Okay. So just wait until I'm done here, and then you can close your eyes if you want to. Great. Do you have any questions for me? I see. Okay, so definitely it's not the first time that I was asked this, so don't worry, it's not a silly question. The next appointment that we will have will definitely be an appointment where everything is going to be wrong with you. How does that sound? Okay, so cranial nerve exam, everything is wrong. Okay, we can do that. Definitely make that appointment, and it's going to be for next week. Okay, it's going to give me enough time to prepare for that kind of exam, and you'll also, try to anticipate what kind of exams I'm going to do in that cranial nerve examination. Lots of exams in this video. So if you don't have any more questions, then I'm going to let you rest a little bit. I'm gonna go ahead and ask the nurse to come in. Okay. Yeah. Perfect. Thank you so much for coming in. It was a pleasure.